Senator from Oklahoma is recognized.
Thank you, Mr. President. As I contemplate what's happening at 62 years of age and looking back through my life, this is undoubtedly the greatest assault on liberty this country has ever had. And it's not direct, it's indirect, but it's what the senator from New Hampshire talked about. Is we're going to decide for you what you get. What the American people still don't understand in this bill is there's 3 areas in this bill that in the next 5 years will put the government in charge of everybody's health care. What you can have, what you can't have, and who can give it to you. That's what's coming in this bill. So if you're a caregiver out there or you're a patient, you might think long and hard about the 3 provisions in this bill that are going to do that. The Medicare Advisory Commission, the Cost Effectiveness Comparative Effectiveness Panel, and the U.S. Preventative Task Force Panel. All of those are going to carry the force of law, and it's not just going to apply to government-run plans. If you have private insurance with your employer today, you're going to be told what treatments you can have, because some group of bureaucracies in Washington are going to decide that. That's what's in this bill. The senator from New Hampshire mentioned several of the claims that have been made. I won't address them again, but I would ask unanimous consent to temporarily set aside the pending motions and amendments so that I may offer an amendment which is the desk number 3556.
Is there objection? No objection? So ordered. Clerk will report.
Senator from Oklahoma, Mr. Coburn, proposes an amendment numbered 3556.
I ask unanimous consent that the amendment be considered read.
Well, objection? So ordered.
This is a constructive amendment that saves millions and millions and millions of dollars in Medicaid. The fraud in Medicaid prescriptions is out of this world. It can be fixed. This amendment will prohibit prescriptions for recreational drugs for rapists and child molesters. Nobody can disagree with that. It's not in the bill. It's the current state. But if this bill goes through without this amendment, your tax dollars are going to be paying for Viagra for child molesters. That's what's going to happen. There is an executive order that this will override. The bill overrides the executive order. So there's no prohibition in the bill for this at this time. The government accountability audit of Medicaid found 65,000 instances of improper prescriptions costing $65 million over the last 2 years. Thousands of prescriptions written for dead patients by people prescribing and posing as doctors. The audits focus on 10 types of frequently abused prescription drugs in just 5 states, which means this audit, which is just over 5 states, multiply it by at least 10, and you got $650 million worth of fraudulent prescriptions in Medicaid alone. We're not going to address that. 65 doctors or pharmacists were banned from Medicaid for writing or filling prescriptions for illegally selling drugs, but just in those 5 states. 1,800 prescriptions were written for dead patients, and 1,200 prescriptions were written by dead doctors, just in those 5 states. The amendment would direct the Centers for Medicare and Medicaid Services to enact the GAO recommendations to prevent and eliminate the fraudulent prescriptions. It specifically would direct CMS to establish a fraud prevention system for Medicaid program and issue guidance for states to prevent the processing of claims for prescription providers and dispense pharmacies debarred from federal contracts or excluded from the Medicare or Medicaid programs. Ensure that utilization of drugs, the review of that, and restricted recipient program requirements adequately identify and prevent doctor shopping and other abuses of controlled substance. Develops a claim processing system to identify both duplicate enrollments and deaths of Medicaid beneficiaries and approval of fraudulent claims. For years, the federal government has required states to provide prescriptions for Viagra and other impotent drugs to Medicaid patients, including convicted sex offenders, child molesters, and rapists. States have provided the coverage based on a 1998 letter from the Clinton administration. As a result of that, an executive order was issued in 2005, which this bill, if unamended, will reverse. 800 convicted sex offenders in 14 states receive Medicaid-funded prescription drugs for erectile dysfunction. That's according to the 2005 survey. The predators of these victims have been as young as 2 years old. So we've got convicted sex offenders, rapists and child molesters that were taking federal tax dollars and buying them drugs so they can act again. Florida, 218 cases. New York, 198 cases. Texas, 191 cases. And it goes down the list. This amendment would prohibit new healthcare exchanges from providing coverage for ED drugs to convicted child molesters and convicted rapists. It's pretty simple. The claims that are made on this bill are outlandish. As somebody who's practiced medicine for 27 years, 50% of my patients were Medicaid patients. What you're going to do if you don't fix some of the things in this bill is destroy the best doctor-patient relationships in the world. That's what you're going to do. You're going to put 16 million people into a failing Medicaid system that the states can't afford. Almost every state is cutting Medicaid reimbursement. At the time, only 40% of the doctors in the specialties will see Medicaid patients. It's going to go to 20. So we're going to put 16 million people in a system, and then they're not going to be able to find a doctor. Because the costs, in my own state, we're going to have an 11% net reduction in Medicaid reimbursement, which is already only 75% of Medicare. What do you think is going to happen in all the states in the country when the Medicaid reimbursement goes down and we add 16 million new people to Medicaid? Then you're going to call it care. You're going to rub your shoulder, rub that metal on your shoulder, and say, oh, we fixed health care. You're going to promise them that they're going to have care, but they're not going to have care. They're going to have a card, but they have no care. We're going to have Indian Health Service type care in Medicaid because nobody's going to be there to care for them. The claims under this bill keep me sleepless at night, not because of Washington, because of those 10,000 Medicaid patients that I've taken care of through my career, that I know you're going to destroy what care is left for them. You can claim otherwise, but the facts are going to prove you wrong. And we're seeing it in every state in the country right now, the cuts to Medicaid reimbursements. So at least you ought to help save $650 million a year by getting rid of fraudulent prescriptions, eliminating prescriptions for convicted child molesters for erectile dysfunction and recreational use with drugs such as Viagra. American people don't want to pay for that. And to vote against this amendment, to not fix something that's very obvious, it is criminal. It's not just not right. It's an active aid to help those who would hurt our children. I'd yield to the majority whip.
Mr. President.
Senator from Arizona.
First, Mr. President, I would say that we're